recently, death of a Bollywood celebrity made a quite buzz in the news channels. Why? Because she was 32 years old and she was supposed to be suffering from cervical cancer. Now in this generation, cervical cancer is quite preventable. So that is why this news is very important. So I am Dr. Tanuka attached to Peerless Hospital as a gynae consultant. My specialty is laparoscopy. I'm going to share some facts with you so that we women are safe. We are safe. Now, starting with the breast. We can take care about our breast by doing just self-examination of the breast once a month by undressing ourselves in front of a mirror, looking at the shapes, sizes, symmetry of the breast and palpating with the palm of our hands for looking for a mass or any specific pain. Now, all the breast pains are not due to breast cancer. There are quite a few hormonal conditions are there which can cause pain, but we need to differentiate. So you can come to doctor for clarification. Now regarding mammography, a lot of people want to come for a mammography screen. But let me tell you, mammography has got a radiation risk. That is why we recommend after 40 years in general. But somebody who has got a breast cancer risk in their family, they can do it as early as 30 years also. But it needs to be individualized. And for example, somebody is feeling heaviness in the breast, premenstrual mastalgia, we usually generally recommend certain medications and ultrasound of the breast, which is quite safe. Now, moving on to, cervical cancer, the topic which I was discussing. Now, cervical cancer vaccination are available. The most of the cervical cancer are because of a virus called HPV, human papilloma virus. They not only causes cancer of the cervix. The cervix means the mouth of the cervix. Uterus. So mouth of the uterus is cervix. So HPV virus can cause this cancer, and we do have vaccine for that. The target age group for vaccine is 9 to 15 years of age. During this age group, we need only 2 doses. After 15 years, this vaccine is still recommended till 45 years on the note of prevention of other genital warts. I think we should all get vaccinated. If we are in that age group, we need 3 doses because this can prevent lot of genital infection also. I'm not talking about sexually transmitted infection. I'm just talking about genital warts. Now, but we need to have screening of cervical cancer that goes like after, it should be done every 3 years in sexually active women till 64 years. So that is very important, and this way we can detect cervical cancer if at all in very early stage, and early detection gives you lot of relief in advanced treatments, so we can get cured very easily. So that is why we need this awareness of vaccination and pap smear screening. Now moving on to uterus, the womb cancer. Now that is very, very rare, but it can happen. So how do we suspect, or how do we doctors suspect? Like somebody who has got a very heavy bleeding, very irregular in the middle age group of 35 to 45. So they should come for a visit of a doctor, and they can go for biopsy depending upon the ultrasound findings. But we need to go to doctor for these problems. Now coming to postmenopausal women who are menopausal, they shouldn't bleed even a spot. So if somebody is suffering from a postmenopausal spotting, please do contact doctors, because out of 100 postmenopausal bleeding, 10 women might have uterine cancer. And trust me, uterine cancer is such a disease which can be cured once after operation and with medication. So we do have treatment of these cancers. And let me come to the ovarian cancer. Now, unfortunately, ovarian cancer is something which generally goes unnoticed. They present with very non-specific symptoms such as bloating, indigestion, and this heaviness in the abdomen. So those are so non-specific that usually ovarian cancers go unnoticed. ovarian cancers can be of variety types. They can be from younger age group to older age group. But if there is any sort of, lower abdominal pain, we can screen ourselves not for the cancer, but for the cause of the pain by doing simply ultrasound, seeking help from the doctor. So that means what? It is not about to scare. These information or facts not to scare you. In the era of Google, we get a lot of information, we get confused, we start getting panicky about our smallest of the issues. So that is why facts are very important. They are very straight cut. The incidences of cancer are very less. But nowadays, because of the social media, we get to know more frequently, and that is good. So that we make ourselves more aware. Thank you. Stay safe, stay aware.